Technology can be a great equalizer. It can be a tool that pushes us apart, but it can also be a tool that brings us together. It helps to lower bars and make things easier. And that's really what we tried to focus on in our department, and in meeting patients with where they were and trying to find new ways to get in touch with our patients. Through the session, I share a couple of examples in my talk of ways that we try to engage our patients. And it's about that. It's going to meet the patient at where they are, at their level, where they want to be, and trying to engage them in their healthcare. I work at Children's Hospital, and so a lot of times that means engaging parents. Not always. Sometimes we're trying to engage the kids themselves, but engaging parents to bring their children into the hospital. And so an example of that is social media. One of the first things that we say is not all social media is a patient engagement experience. You have to really focus on the patient as the target audience, or in our case, the family is the target audience. But we have a tool to get information to the families when they need it. And so we really try to do that through our blog, for example. The blog, we know that no one reads our blog every day. It's not a blog designed like that, and I don't believe most healthcare blogs are, but it's there when you need it. When your child's sick and you have a question, we know that you're going to turn to Google, and we want to be there for you when you have that question. And so that's sort of passive patient engagement. We also have tools to actively engage patients. An example of that is we built a text messaging app to remind families not only about their appointment, but that we had a change of location. We were doing some construction on our hospital and had a temporary location for MRI. And so we wanted to send families reminders of that appointment and that location in case they were having trouble finding us. And so that text message included directions to the new location, a phone number where they could call and ask for help. And it was sent in a semi-automated way. We tried to go around a strategy of thinking about the entire patient journey through our system. And from the provider point of view, we talked about the value stream of the different steps that a patient takes as they go through our system. And so we try to find elements to engage our patients at every step along the way. And so that's from the moment the order is placed, that's something that happens to them in relation to radiology. They're in discussion with their physician who's placing the order, and there is engagement at that level. But once they move into radiology, the order is placed, and so we want to do things to try to get them engaged from that level. And that's where, so once the order is placed, the first thing a patient may do is research to figure out either the location that they want to have their imaging performed, or what the condition that their imaging is supposed to identify. That's where an example like the blog comes in. Scheduling would be then the next step. That's been a place where radiology has not done a great job traditionally. We have challenges with the online scheduling. This online scheduling is in every aspect of our world, but it's a hard thing to do in radiology. We rely on an order. Not everyone has that order electronic. It's not in every system. And so there are unique challenges with that that many places haven't solved. And then it becomes prep instructions. Many tests, not all of them, but many tests require patients to have something to be prepared for the test. That can be not eating before the test for a certain amount of time, or even drinking something ahead of their test. And those type of things, how do we give instructions that meet their needs instead of it being sort of cookbook where everyone receives the same instructions? So we try to look at things along every step of the way and do things to make it easier for our patients. And eventually getting to the point where we're empowering them to take care of themselves or to be a partner in their healthcare. And so many of the things I was describing, or sort of passive, where we put it out for the patients, but they have to do something, like if we were doing online scheduling. Other things can be more active, sending them their results and trying to engage them in the results, giving them options for having direct conversations with radiologists or getting direct results from radiologists. Other examples would be just giving them their images and not doing it on a disk and a media that they can't use, but giving them ways so they can see their images through the patient portal in a way that they're interacting with the rest of their healthcare. And so we try to do things along that entire spectrum.